Okay. Hello everyone. My name is Annisa Pradhita Gita Cahyanti. I want to presentation our work team on nursing diagnosis intervention. Okay, uh, this is my partners. First, Fathurrohman, then Anggita Novia, then me Annisa Pradhita, and then Bunga Mawar, and then Deviana Fatika Sari, and then Elsiana Anida, and then Reni Ardia, and then Rafikoh, and then Cindy Nur Jannah. Okay, this is the case in assessing the patient main complaint, abdominal pain. A review of the history now shows that the patient was admitted to the hospital complaining of liquid vaginal discharge. After this section procedure approximately 6 months ago. The patient came to the hospital on 13 April 2023. Letters from Dr. Mirza for radical hysterectomy. Then the patient was taken to the ER and prepared for hospitalization. The patient was then treated at a 6-week planned radical hysterectomy program on 15 March 2023. On 13 April 2023, the patient was consult for treatment by Dr. Arwedi. On 14 March 2023, the patient had a transfusion of 2 flash PRC and 1 flash albumin. Correction. On 50 April 2023, the patient underwent a radical hysterectomy. After the operation, a laboratory check was carried out and another transfusion of 2 flasks of PRC was carried out. Currently, the patient is undergoing a post-HI surgery recovery program in room 6. In room 6. Suddenly, the patient complains of weakness, fatigue, and sometimes dizziness. After a health assessment, data was obtained before being admitted to the hospital on 23 November 2022. The patient was treated for a cervical biopsy and the result squamous cell sarcoma. Approximately 6 months ago, the patient gave birth by section. The patient has allergies to the drugs Lofenox and Aspilet. The patient family health history showed that no one in the family suffered from the same disease as him. The patient said that no one in the family had a history of diseases such as diabetes mellitus, hypertension, or heart disease. The patient lived with her husband and 1 child. On examination of vital signs, it was found that there was composematic awareness with a total DCS of 15. Examination of vital signs revealed blood pressure data 160 mEhg, MAP 73 mEhg, pulse 100 for the minute, respiratory frequency 17 for the minute, chest type, temperature 26.4 Celsius in axilla, weight 45 kilogram, height 158 centimeter, BMI 18 kilogram. Abdominal examination. Abdominal inspection looks flat, supple. There appears to be a post-operative bandage that is not seeping. Auscultally, intestinal peristalsis is found 12 for the minute. Palpation show tenderness around the post-operative wound. Percussion of the tympanic. In dry skin turgor extremities, muscles strength in for part of the extremities. 5. Data on asexual reproduction pattern was obtained before being admitted to the hospital. The patient said the white fluid came out of the vagina continuously after giving birth 6 months ago. The patient said she had not had intimate relation with her husband since giving birth 6 months ago. After being admitted to the hospital, the patient said she had not had intimate relation with her husband since giving birth 6 months ago. The patient said he started menstruating at the age of 12 years with a cycle once a month for approximately 7 days. The patient said he did not use any birth control. The patient told the nurse about sexual frequency and asked about reproduction after the hysterectomy operation. The patient appeared to be accompanied by her family and husband. Okay, this is a supporting date for the data from for the data laboratory and vital sign and the uh, result. The okay, next um, my team uh, chose three diagnosa. There's diagnosa, and first diagnosa is acute pain associated with a physical injury agent. Subject uh, PKRST, P provoke. Patient says post-operative pain, quality pain like being cut, regional pain in the lower abdomen, scale 5, time pain occurs when doing activities. And the object, the patient is conscious. The patient appears to grimace in pain by holding the lower abdomen. The patient appears that the postoperative dressing is not CP. And blood pressure 160 mmHg, MAP 73 mmHg, temperature 36 dot for Celsius in axilla, respiratory rates 17 for the minute, and pulse 100 for the minute. Okay, next, and the diagnosis our choose, the second diagnosis our choose is infective peripheral perfusion associated with decreased hemoglobin concentration. Uh, subject, patient size weak, tired and dizzy. Object, the result of examination on 15 April 2023. Hemoglobin concentrate is 8.7 G for the DL. Patient post-radical hysterectomy surgery. Age 2 patient looks pale, conjunctiva. And the last diagnosis my team choose is the third, nutritional deficit associated with biological factors. Subject, patient size, nausea, and no appetite. And this is object, the weight 45 kilogram current and 49 kilogram before illness. And the height and the body height 158 centimeter and EMT 80. Okay, next. And this is intervention for the first diagnosis is acute pain associated with a physical injury agent. And this is the intervention outcome pain reduce or disappears. Need pain control outcome criteria. One, knowing the factor that cause pain. Two, knowing the onset of pain. Three, use preventive measures. Four, report symptoms. Five, reporting pain control. And now management activity pain. One, conduct a true assessment of pain including location, duration, quality, severity, and precipitating factor. And two, observe nonverbal discomfort. Three, teach non-pharmacological techniques such as relaxant, guided imagery, music therapy, distraction. And four, control environmental factors that may affect the patient's response to discomfort, the edgy temperatures environment like noise. And five, collaborating administration of analysis according to indication. And and then and the intervention second intervention we choose outcome tissue perfusion cerebral and neck tissue perfusion cerebral. One, systole and diastole pressure within the expected range. Two, no orthostatic hypertension. And three, no sign of increase in cranial pressure, no more than 15 mmHg, and no peripheral sensation management. One, monitor specific areas that are only sensitive to hot, cold, sharp, blunt. Two, monitoring paresthese. Three, instruct the family to observe the skin for cuts or laceration. Four, use glove for protection. And five, limit head, neck, and back movement. And six, monitor the ability to defecate. And seven, collaborative administration of analgesic. Eight, monitor for thrombophlebitis. And nine, discuss cause of change in sensation. And the last intervention for the third diagnosis, we choose nutritional status. Outcome nutritional needs met. Need nutritional status result criteria. One, maintaining body weight within normal limits, ideal body weight. Two, tolerance to the recommended diet. The patient is willing to eat the diet given at least half portion, good appetite. And three, reporting the strength of energy level. The patient is not weak and weak. Four, expressing willingness to follow the diet the patient is willing to eat. And not nutritional management. One, assess the food to which the client is allergic. Two, determine the client's favorite food. Three, encourage the patient to choose soft food. Four, encourage the patient to increase protein and vitamin C. Five, avoid spicy, sour, or oily food. And six, monitor nutrient and calorie intake. Seven, the less collaborating, discuss with the dietitian in determining the amount of calories and protein needed. And B, discuss with the doctor the need for appetite stimulation complementary food. Okay, that's all. This is our presentation. Thank you for your attention and see you next time and see you again. Thank you.